Image processing in oral radiology. Radiology is all about capturing the perfect image. Let's start with conventional film. Imagine the film as a canvas that needs chemical magic to reveal the image. Conventional film uses two main chemicals. Developer converts exposed silver halide crystals into black metallic silver, forming the image. Fixer removes unexposed silver halide crystals and makes the image permanent. The processing steps are development, rinsing, fixation, washing, drying. Common darkroom errors include light leaks causing fogged film, improper timing leading to over or underdeveloped images, air bubbles leaving white spots on the film. Next, we move to digital radiography, faster, safer, and environmentally friendly. There are three main types: CCD, charged coupled device, direct digital sensor, instant image; CMOS, complementary metal oxide semiconductor, similar to CCD, faster and cheaper; PSP, photostimulable phosphor plate, stores a latent image later scanned to produce the digital image. Advantages of digital radiography include less radiation exposure, immediate image availability, easy enhancement and storage, eco-friendly, no chemicals needed. CCD versus PSP. CCD is rigid, gives an instant image, and has high resolution. PSP is a flexible plate, needs scanning, and has slightly lower resolution. Both are widely used depending on clinical needs. Remember this mnemonic. For film steps, DFRWD, developer, fixer, rinse, wash, dry. For digital, CCD equals click, PSP equals scan, to remember the difference in acquisition. Written exam questions. List the steps of conventional film processing. Explain the function of the developer and fixer. Compare CCD, CMOS, and PSP detectors. State at least 3 advantages of digital radiography. Identify 2 common darkroom errors. Summary. Conventional film. Developer, fixer, rinse, wash, dry. Digital detectors. CCD, CMOS, direct, PSP, indirect. Key advantage: lower radiation, instant results, image enhancement. Mnemonic: DFRWD for film, CCD equals click, PSP equals scan.